Joining with us is the Kerala Health Minister. Let's ask in a first chat with Republic TV after taking charge what she is looking forward to the health department in the state. Thank you, ma'am, so much for joining. My first question: health department in Kerala is now looked with a global eye. People all over the world are looking. So, how do you feel like taking charge, and what do you think that you're going to bring in? New set of reforms, and what do you see yourself doing in the coming years?
So the initial focus is to control the pandemic, and our focus is on getting our people vaccinated, and we are going through the second wave. The peak was on May 12th. And we have many challenges. As you all know, the population density in Kerala is double that of the national average, and also the number of diabetes patients is also very high in Kerala. And the senior citizen population, we have the people above the age of 60 is the percentage is also very high. So we are taking up the challenges of the pandemic in all these situations. So we have to, at present, the initial focus is on getting our people vaccinated. So things are moving on.
Like after taking charge, there's a lot of demand. The state puts it on the center. Yeah. So how have you been, your interaction with the center, and how do you see moving forward in terms of getting the vaccination and getting all the other necessary support to ensure that the death is decreased, and how we fight forward?
We have a good communication with the central government, our department, and the health ministry. And we do have many problems because during this time, one of the problems were raised by the NRIs, the non-Kerala residents of Keralites, and it was regarding the certificate, COVID certificate, because in the certificate it was like a Covishield, and the name they wanted to get it changed to AstraZeneca, and we have asked the central government, and now we started giving certificate, state level certificate, but I think the government of India has now changed the name, and also and in that certificate also the Aadhaar numbers were entered, but we wanted the passport numbers to be entered up, and now the government has changed it, but we have already started giving another certificate, but we are looking forward, because every state should have a very good relation with the central government. Yeah.
And in the last budget, there was an impetus on pediatric, infrastructure development in the state budget, as well as now Nirmala Sitharaman has also given a lot of funds for combating the third wave and getting a pediatric infrastructure. So, do you see that we will be getting more assistance from the center, because the center has said, apart from the 8 metros, other places will be getting these facilities and funds. So, how do you see this? Do you is the state campaigning for it and ensuring that more assistance comes that way?
We are requesting the central government, central ministry, to give us more help, because as in Kerala there are more susceptible persons, because in the first wave only 11% of the total population got infected, and in the second wave also the number of positive cases, when we compare it with other parts of the state, is less in Kerala. So it means that there are more susceptible persons in the state. So there are chances are very high that more people will get infected. Maybe in this last lap of the second wave, or in the third wave. So we need more help from the central government, and it's in the supply of vaccine, and also in other like the pediatric, in improving the pediatric facility and all. Anyway, we are very hopeful that the central government will be helping us.
Yes. Kerala has been very good at developing the infrastructure at the taluk level, at the local level. So how do you plan to strengthen it further?
See, our system is like we have a primary sector, we have a secondary sector, and we have a tertiary sector. So it is our health system is working like that, because if anybody has a problem or any illness or disease, he can go and consult the primary health center, and there is a doctor, and we have converted to family health center. The concept is that there is a doctor for a family, so that doctor will be knowing everything regarding the family and the individual. And then if he can refer that patient to the secondary, that is the district hospitals or the general hospital or the taluk hospital, and from there to the tertiary hospital as medical colleges, and we are strengthening all the system. We have converted through our Ardhra mission. We have converted the primary health centers to family health centers, and we have made the district hospitals and the general hospital to specialist hospitals. Like we have introduced cath labs and other specialty services, and also now in medical colleges we are moving very fast, and the infrastructure developments in the medical colleges in recent years is something which is very special, and we are moving.
Thank you so much, ma'am, to speak to the Republic. Thank you. That is the Health Minister of Kerala, Veena George, speaking exclusively to the Republic after taking charge. And she says that the Kerala is strengthening its health infrastructure at the massive level, at a phenomenal level, and looking forward to take on the COVID pandemic, as well as ensuring that the third wave doesn't hit the state.